How are you, mate? Drew? Whew. Okay. David Crisafulli with Dr. Mark Robinson and Rebecca Young. Testing 1, 2, 3. Hello, Brendan. We're good to go? Yep. Well, today we will be having our 31st Queensland Health Crisis Town Hall, and this one is here in the beautiful Redlands. And behind me is a room full of brave Queenslanders who will stand up and tell their stories about being let down by almost a decade of poor planning and poor resourcing of the health system. And today you will hear those stories from brave Queenslanders, and you'll also hear across the board the frustration that the frontline staff are experiencing in trying to deliver services for these Queenslanders. Increasingly, as we listen to people about their journey in the health crisis, every one of them can see the pressure that the system is under. Every one of them knows the frustration for an AMBO stuck at the end of the ramp, for a doctor and nurse trying to provide a service, and for a Queenslander who waits at the end of the phone for an ambulance that won't turn up because of a poorly resourced and planned system. The numbers that were released in the cover of darkness show just how dire the situation is with Queensland Health. And in a moment I'm going to ask Mark to explain what they mean locally here at the Redlands. But make no mistake, across the state, the Queensland health crisis has reached levels that remain not only stubbornly high, but show the government is refusing to listen to solutions. At 43%, the Queensland ramping figure is the worst in the country. And it is nearly 3 times what it was when the government came to office, and it had already doubled before COVID. And the government can blame all sorts of people. They can blame other governments in the past, they can blame governments in Canberra, they can blame diseases, they can blame funding streams. But in the end, the one consistent has been the same government that has presided over a broken system and has refused to listen. And the solutions are on the table. Better resourcing, better triaging, sharing data in real time, and above all, putting doctors and nurses back in charge. The Queensland health crisis is impacting people across the state, and it is time for the government to admit there are solutions on the table and they should adopt them. Over to you, Mark.
Thank you, David, and thank you, folks, for coming out to the Redlands. The Redlands Hospital is one of the worst cases that we can see of the Queensland health crisis. When you look at the facts, and let me give you some facts, ambulance ramping is at 63%. That's almost 2 out of every 3 Redlands patients are being ramped in ambulances. It's the biggest quarterly increase across the whole state. We see, in terms of emergency department waiting for beds, that 28% of Redlanders are not able to be put through into a bed after being at emergency. So 28%. We see the elective surgery waiting list, 1,160 people waiting for their elective surgery. And the other really crucial, damning statistic is the outpatient waiting list, 4,560 people waiting to see a specialist. They're just some of the facts that we see here at Redland Hospital. So what we are seeing is the absolute failure of the Queensland government to deliver for the people of Redlands. They promised at the election at 2020 to deliver an ICU and a new intensive care unit. We don't have an intensive care unit. We're the only metropolitan hospital that doesn't have an intensive care unit or critical care area. They promised 32 beds. All of this was to be delivered, new beds delivered by late 2022, and here we are in 2023 and it's not been delivered. The Redlands Hospital is the only hospital, as I've said, to not have an ICU, and in fact when we look at bed numbers, in 8 years there's been no new beds, no new overnight beds, and in fact we have 7 less beds available to patients at Redlands Hospital, another damning failure of this government. So the people of Redlands have learnt they can't trust Labor when it comes to delivering on health. What they get is chaos and crisis, and it's completely unacceptable.
Good morning, everybody. My name's Rebecca Young. I'm the LNP candidate for Redlands. I'm really happy to be here at Victoria Point this morning to once again listen to our community. As you've just heard from Mark, we have some pretty damning statistics here in Redlands. So getting into this room today, listening to what the good crowd of people want us to hear is our number one priority. And I thank David Crisafulli for joining us here in Redlands.
Over to you.
The government is saying at the satellite hospital presser today that the LNP needs to rule out either privatising or selling off satellite hospitals should the LNP win.
Of course, of course. But I'll tell you what I'll rule in. I rule in calling them what they are, and I rule in properly resourcing them, and when you make a commitment, you deliver it on time and on budget. And I'm sorry if that runs contrary to the government scare campaign, but that is what it is. These facilities provide a service that the community will welcome. It's just not what they were promised. They were promised a hospital, and they were given a timeline that was going to be delivered and a cost that it was going to be delivered, and they were sold a vision of a hospital. Now, it doesn't mean that the services provided there aren't things that will be welcomed by the community, and they're going to be welcomed by us. We just want them to be called the right thing, and we want them to be properly resourced, on time and on budget.
The situation in Redlands is one of the worst almost in the state when it
Really?
comes to ramping and delays. What's your solution overall to fixing what is happening in the Redlands? The government's going with a satellite hospital or a satellite facility and this stage 2 upgrade to Redlands Hospital. What would you do if you win office? How would you fix this?
Make commitments and hold ministers accountable. Today, the government is promising to turn a sod on a facility 6 months after they said it would be opened. Now, if there's not a damning indictment of a failure to plan and deliver, I don't know what it is. And when you look at a region this size to have no intensive care beds, and when you look at the fact that there are 7 fewer beds than 2 years ago, you know there is a problem. So we want to fast track and get cracking, and we want to bring those stages forward. And anything short of that is a cop-out, because that's what this community was promised. So of course we believe there are solutions as well as investing in extra resources. And we do believe with improvements to triaging and data and the culture and the way that Queensland Health is run, that there can be improvements made. But above all, I just want ministers to be held accountable for their promises. And today what we've seen is a different messenger, but the same message. It's always someone else's fault. There's always some shiny announcement. What there's not is facilities that are working and staff that are empowered and a community that are getting served. And Queensland is growing tired of it. And I spent the entire morning yesterday at a markets listening to Queenslanders, and there is a growing awareness from people that the government make announcements that are in the interest of the government, not in the interest of the community. It's always about finding a political relief. It's always about just getting over that next hill. It's never about actually Queenslanders. It's never about servicing them. And this is a classic example.
So your approach would be to continue on the same hospital upgrades, stage 2 expansions and the satellite facility. Is that what you're looking at,
Yeah.
along with your own sort of improvements that you announced there?
Of course, and
no further facilities or nothing else that the people of Redlands could take away?
Well, no, ahead of the next election, we'll be putting forward a detailed health plan, and that'll involve individual hospitals and what that looks like. And the promise I can make to every Queenslander is if we say that beds will be open on a certain date, you can bet your bottom dollar they will be, and there will be ministers held accountable for that. And after nearly a decade of broken promises, I think Queenslanders could be forgiven for running out of faith and trust in this government. And I'm asking Queenslanders to understand that when I say something's going to be done, it will be.
How would you bring those stages forward?
By properly resourcing it, not putting money into the Never Never, which we've seen in the Queensland Health budget for many years, and by holding ministers accountable for that spend. The facility the government is promising to turn the sod on, before the last election, they told Queenslanders would be open last year. The medical facility that they brand as satellite hospitals, there was never the caveat to Queenslanders that there wouldn't be beds and there wouldn't be an ED. So be honest with people, be upfront. We're seeing a culture that before an election the government will put timelines and deliverables on things that they know that aren't true. But you can only do that so many times, and approaching their fourth term and wanting 14 years in office, Queenslanders are starting to grow tired of the same old playbook.
Just one more for Rebecca. The government's attacked you for supporting satellite hospitals and then funding up and not being so complimentary about them. What's your actual position? Do you think they will work to help Redlands?
Sure. So in terms of my support of that facility, initially it was as a role as a Chamber of Commerce President, a volunteer position within our community as a community leader, and they lied to me, as they did my community, as to what that facility would actually be. So we welcome health facilities within the Redlands, but they've got to meet the needs of the community. And with stats that have been delivered to us today, that's not happening.
All good?
Yeah, perfect. Thank you very much.
Thanks very much. Well done. Now you have to fix your... Well, you can do that there. And you have to